Autologous microfragmented adipose tissue injection combined with core decompression for treatment of early-stage osteonecrosis of the femoral head. Conflict of interest. The video is part of the submission and has been viewed by all authors. The authors have no conflicts of interest to declare. The anesthetized patient is put in the supine position on a radiolucent traction table. The lower or the lateral abdomen is chosen as the donor site for adipose tissue harvesting. After disinfection and draping, 17G blunt cannula connecting to a Lurelock 60 ml syringe is injected in 50 ml aliquots into the subcutaneous fat of the lower abdominal area. Following a 10-minute interval, the adipose tissue is hand-extracted through a violin movement on the superficial, and then deep layers with a 13G blunt cannula connected to a 20 ml syringe, and transferred into a 60 ml syringe. Tissue processing starts with a first cluster reduction obtained by pushing the aspirated adipose tissue from the 60 ml syringe into the device through a first size reduction filter while allowing a corresponding quantity of saline to exit toward the waste bag. The next step is shaking. The surgeon shakes the device, and the stainless steel balls emulsify the oily residues, blood components and cellular debris that are eliminated by gravity in the waste bag. The washed and reduced adipose clusters migrate to the upper portion of the device. The chamber is then flushed with saline to wash out impurities. When the saline solution inside the device became transparent and adipose tissue appeared light yellow, stop passage of the saline solution and turn the device upside down by 180 degrees, with the fat tissue facing a narrower size reduction filter. The second adipose cluster reduction is obtained by passing the floating adipose clusters through this second size reduction filter by pushing additional fluid from the lower opening of the device using a 10 ml syringe. After collecting lipogems, the syringe is positioned vertically to decant and excess saline is discarded. Decanted lipogems tissue, MFAT, is transferred into several 10 ml syringes. After creation of 2 decompression tunnels, MFAT is injected into the femoral head via a special puncture needle with a total volume of 10 ml in each side. This is a 29-year-old male with bilateral osteonecrosis of the femoral head, ARCO stage 2, who received bilateral autologous MFAT injection combined with core decompression. When he came to the outpatient 3 months after surgery, he felt no pain, regained normal gait, and could easily stand up from squatting. The Trendelenburg sign was negative.